Complete Blood Count, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Complete Blood Count, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of a complete blood count. Chapter 1. 1. What is a complete blood count? A complete blood count enables the measurement of blood components. 2. What are the components of the blood? The components of the blood include red blood cells, white blood cells, platelets, hemoglobin, hematocrit, mean corpuscular volume, etc. 3. What is the function of the red blood cells? Red blood cells carry oxygen and carbon dioxide. 4. Red blood cells are also called erythrocytes. 5. What can cause a high red blood cell count? A high red blood cell count can be due to diseases of the lung, kidney tumors, polycythemia, dehydration, etc. 6. What can cause a low red blood cell count? A low red blood cell count can be due to anemia, blood cancers, lymphomas, etc. 7. What is hematocrit? Hematocrit is the amount of blood that is composed of the red blood cells. 8. What is polycythemia vera? Polycythemia vera is a disease that causes an excessive production of red blood cells. 9. Is polycythemia vera a rare disease? Yes, polycythemia vera is a rare disease. 10. What is anemia? Anemia is an insufficiency of healthy red blood cells. Chapter 2. 1. What is erythrocytosis? Erythrocytosis is an abnormally high concentration of red blood cells. 2. What is the reticulocyte count? The reticulocyte count is the number of new red blood cells. 3. What is mean corpuscular volume? Mean corpuscular volume is the average size of red blood cells. 4. Are white blood cells part of the immune system? Yes, white blood cells are part of the immune system. 5. What is the function of the immune system? The immune system protects the body from harmful substances. 6. What is a complete blood count with differential? A complete blood count with differential measures the total number of white blood cells and the number of the different types of white blood cells. 7. What is the function of white blood cells? The white blood cells help to fight against diseases and infections. 8. White blood cells are also called leukocytes. 9. What could a higher than normal white blood cell count indicates? A higher than normal white blood cell count could indicate an inflammation or an infection. 10. How many types of white blood cells are there? There are 5 types of white blood cells. Chapter 3. 1. What are the 5 types of white blood cells? The 5 types of white blood cells are eosinophils, basophils, monocytes, neutrophils, and lymphocytes. 2. What is the largest type of white blood cells? The largest type of white blood cells is neutrophils. 3. What is leukopenia? Leukopenia is a low white blood cell count. 4. What is agranulocytosis? Agranulocytosis is a condition where there is insufficient production of white blood cells in the body. 5. What can cause a low white blood cell count? A low white blood cell count can be due to anemia, a viral infection, bacterial infection, bone marrow disease, radiation therapy, chemotherapy, etc. 6. What can cause a high white blood cell count? A high white blood cell count can be due to an infection, certain medications, leukemia, allergies, etc. 7. What is leukemia? Leukemia is blood cancer. 8. What is lymphoma? Lymphoma is cancer of the lymph. 9. What is the function of hemoglobin? Hemoglobin transports oxygen to the body. Chapter 4. 1. What is the function of platelets? The function of platelets is to clot blood. 2. Platelets can also be called thrombocytes. 3. What is thrombocytopenia? Thrombocytopenia is a lower than normal platelet count. 4. What can cause a low platelet count? A low platelet count can be due to a viral infection, a bacterial infection, radiation therapy, chemotherapy, leukemia, and SAIDs. 5. What is the major risk of thrombocytopenia? The major risk of thrombocytopenia is bleeding. 6. What is thrombocytosis? Thrombocytosis is a higher than normal platelet count. 7. What can cause a high platelet count? A high platelet count can be due to anemia, polycythemia vera, an infection, hemorrhage, splenectomy, etc. 8. What is splenectomy? Splenectomy is the removal of the spleen. 9. What is the major risk of thrombocytosis? The major risk of thrombocytosis is blood clots. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding a complete blood count.